I think we're ready to go.
Hey, how's everybody doing today? This is Tracy Thomas and Greg Moody with RevFlix, and we're here with Dr. Hurley from Hurley Chiropractic today. And we're kind of excited to talk a little bit about what she does for people in the community and helping people out. Everything from, people that are having headaches to auto accidents. And we're just really excited to bring everybody on board and let everybody know kind of what she's doing out there. And it's really an interesting story, what she has to share with us today. So we hope everybody enjoys it. And we'll be asking a few questions, and she's going to go ahead and do her best to answer those and get everybody straightened and narrowed as far as what she does in that community out there. So Dr. Hurley, if you don't mind, could you tell us a little bit about Hurley Chiropractic and maybe about how it got started and how you got started?
Sure, Tracy, thanks for having me. Hurley Chiropractic is a clinic in Conway, Arkansas. It was founded by my mother, Dr. Christine Hurley, over 25 years ago. And we've kind of become a big name in the community. And that is because my mom always held that vision to try to serve as many people as possible in the community through life-changing chiropractic care. So my mom unfortunately did pass away last year. I was able to step in and take over and continue her legacy. And we're proud to be doing that.
Well, very good, very good. So with what you see going on, we see all this, we see a lot of stress going on, and we'd like to talk a little bit about your services and the treatments you offer to community members, especially in times right now. I personally go to a chiropractor every 2 weeks, and it's, she always has me set up to where it's something that I'm always doing maintenance. And what I find out is if I go 6 months without going to chiropractor myself, I can be carrying something around, and all of a sudden it's just like, oh, this happened. I can't believe it. But as long as I'm working out and training, which I love doing, but I also enjoy going to the chiropractic, and they have a massage therapist there that also kind of takes care of us and my wife and I. So if you could share a little bit about what you offer as far as your services and the treatments you offer there.
Absolutely. So I think you mentioned one thing that is sometimes a concern for people when it comes to chiropractic. People hear, once you start going to the chiropractor, you can't stop going. You have to keep going. And as you mentioned, Tracy, I kind of reply, well, once you start realizing how much better that you can feel when your spine is balanced and your body is aligned, you won't want to stop. So it's kind of one of those things that people consider a negative, but it's truly a positive when you realize that balancing the spine, optimizing your whole nervous system has a huge impact on your quality of life. So I just want to break down for everybody a little bit what is chiropractic and what is an adjustment. Chiropractors are looking for areas in the spine that are stuck or not moving well. So when that joint in the spine gets out of balance or gets stuck, it can cause pain, but it also affects all the nerves that are coming from the spinal cord and going to control everything in the body. So while a lot of people do come to us for pain, and a great bonus or side effect of chiropractic is pain relief, really our goal is to help the spine to move properly. And that not only benefits the health of the spine itself, but also the entire nervous system. That's why sometimes people say, after getting adjusted, I felt like I slept better, or my asthma improved, or my anxiety improved. That's not because we say we cure or treat any of those symptoms or conditions, but because when your spine is aligned and your nervous system is functioning optimally, the body does amazing things to heal itself. So that chiropractic adjustment, we deliver an adjustment to that area, and we help that joint in the spine to get moving again properly. We also have, like you mentioned, your chiropractor has a massage therapist. That's important too, because when the adjustment addresses the spine, we have all those muscles around it that attach to it. So we have massage therapists, passive therapies, and physical rehab therapies that help to stretch, strengthen, and relax those muscles, helps support the adjustment, and helps it to create more lasting effects. So we kind of are all in one-stop shop at Hurley Chiropractic too. We can help with multiple different facets and all different kinds of people, like you mentioned. People do come to us with headaches, neck pain, back pain, and chiropractic and massage, physical rehab is wonderful for that. It's really important after a car accident to get checked, as you mentioned, and we do work with attorneys and PI cases to help to kind of address that, all that force that your body absorbs when you do have a car accident. And then I personally love to work with pregnancy and pediatric is a specialty of mine. I think every pregnant woman needs a chiropractor throughout her pregnancy to not only relieve those aches and pains of pregnancy, but to help your hips to be aligned for a more optimal birth.
That's awesome.
Can I ask something too? It seems like you guys do so many treatments about, that cover so many different areas of people's life too. You work with kids that are even kids that are young that have issues too, right?
Absolutely. And babies and children, they don't typically come to us with back pain, headaches. Occasionally, maybe a parent brings them in because they fell on the playground and they've been complaining of a knee pain or hip pain. But more with babies and children, we're trying to optimize that nervous system again. We're adjusting them to help them sleep better. It can improve digestion. With little babies, we can help their breastfeeding and nursing issues be troubleshooted. Constipation is a huge one that chiropractic helps with kids to just improve the digestion and get the whole system working better.
So that's amazing. And it sounds like if I have knee pain, I should come to you. And a lot of people that, are my age, I'm in my 50s. So it would be a big deal if I have knee pain or other joint pain that might not seem, I think people think about chiropractic like being back related, only back related, but it really is anything all through the whole body.
Absolutely. Yeah. A lot of times, somebody won't have necessarily anything wrong in that joint or pathology. So they say, oh, it's just because I'm getting old. The doctor said there's nothing I can do. Maybe they have called it arthritis and said there's not much that we can do, but really balancing the spine and working on those joints in the knees, hips, ankles, elbows, wrists, shoulders. It does amazing things to keep us going and keep us functioning.
Yeah. And I think it's interesting, when you're mentioning this, Dr. Hurley, right now, I get excited just listening to it because, for all of us as we age, or if we're even younger, I'm in my 50s, but if I was 20 years old or 30 years old, I was doing chiropractic care back then. And I feel like it's played such a large role. My doctor's, is always asking, what do you do every day, to keep so fit? And it's fitness isn't just going to a gym. I think fitness totally is. The massage helps me so much. The chiropractic care helps me, and those two interlinked. And their discussion amongst them, they know what's best for my body better than I do, and it just keeps me active. I can everything I can do. I've been to I've had carpal tunnel. I've been told by doctors I need surgery for 10 years. When my carpal tunnel gets bad, I go to the chiropractor, I get a massage, a little bit of rolfing going on there. And next thing you know, it's fixed. I've had people tell me that I need different parts of my body worked on and fixed surgically. And I find out a lot of times the pain's just alleviated. It's not one and done. It's not one session. It's done. It's over. I truly believe, and I'm passionate about telling people, as everybody I know, I'm always saying to the chiropractor, go as often as you can, because you go to the gym twice a week, but then you don't go to the chiropractor once every 6 months or a year. So if you could touch bases a little bit more on that, and how you help people, because I see, I have a neighbor, he was walking around like this the other day. I said, what's wrong? He said, I slept on the pillow crooked. I was like, go see a chiropractor. I can't tell you. You do the chiropractic care, you get the adjustment, and sometimes they tell you to do the massage first, they work with each other hand in hand. But if you could talk a little bit about that, I think it could really help some people out in your community.
Sure, absolutely. Yeah. So I think kind of like you mentioned, the longer you wait, you can feel really good when you first go, and then you wait a while and the pain comes back. Well, that's probably because the true issue was never resolved. So chiropractors, we're not just, of course, we care that you're in pain and we want you to feel better, but in a way, we don't care about your pain. Our goal is to help the motion of the spine and the balance of the whole system. So even if you come in today and you say, I'm feeling great, 0 out of 10 pain, nothing wrong, I'm still going to use my hands to check your spine. I'm still going to look for areas that might need an adjustment. So just because you don't have pain doesn't mean that there's not an imbalance. It can have an effect on other parts of your body that you may not be aware. So it boosts the immune system. It helps the brain work, and it helps your heart beat and your lungs breathe and your stomach digest. It really impacts the entire system. So we aren't just going to say, oh, you have neck pain today, I'm just going to adjust your neck. Every time a patient comes in, we're checking their full spine, head to toe, and trying to make sure that everybody's balanced and functioning well.
That's really amazing, though, that it's really your whole body all the way from, because it's your nervous system that you're fixing. It's not just like somebody just cracking your back, like I hear somebody say. but it's your whole nervous system. And that does make sense that it would connect to everything else.
Right. We think about our nervous system as our brain, our spinal cord runs throughout our spine, and then all the nerves that leave the spine, they go to control every single thing in the body. Like I said, our sensations, our motor functions, but also all the systems in our body. So it may sound far-fetched for somebody to say, how could chiropractic be related to allergies? Could it be related to an ear infection in my kiddo? How can it be related to or impact my pregnancy or my birth? But when we realize that everything in our body is controlled by the nervous system, and the nervous system has such an intimate relationship with the spine, it begins to make sense why an adjustment to the spine is so powerful to the whole system.
That does make sense.
Yeah. Yeah, definitely. Doctor, I have another question too, is, for the people that are watching right now, I cannot say this I've ever felt this way, because my parents, both my parents went to chiropractic care. All the kids, there's 5 kids in the family. We all grew up going to chiropractic care, so we all been part of it for all of our life. So we don't know, but I do, like our neighbor. I was just mentioning our neighbor. He says next kink, and I was like, go to chiropractic care, and he's like, people have this look about it that it might be a little rough or the unknown. What can you do? What can you do to let people know that this is a nice experience? This isn't a painful experience.
Absolutely. Yeah. So one of the things in our office that I prioritize is we're communicating throughout your entire first adjustment. So I'm not going to lay you down on the table and crack you without you understanding what's going on. I'm always going to let you know where I'm going to place my hands, where you're going to feel maybe me push into a certain area, and what to expect. So first of all, I think overcoming that anxiety of not knowing what to expect, I really prioritize in my office, myself and all my doctors really help to communicate up front so you know what you're getting into and you're comfortable the whole time. I think that's the first thing that's most important. Secondly, we have lots of techniques. Myself and all of my doctors are trained in multiple techniques. Some are more high force and some are very, very gentle. Like for instance, when we adjust a baby, people get worried about that, but there's no popping, no cracking with the baby. We use very gentle pressure just with our fingertips. So you can see that there's a huge variation from maybe what you've seen an adjustment on YouTube look like,
right?
The different types of techniques. Also, additionally, in our office, we have the high-tech software of a Pro Adjuster. So a Pro Adjuster is an instrument tool for people that are not comfortable to lay down or don't want to be twisted or popped. Maybe they're in so much pain, they can't handle a manual adjustment. So we use a gentle tool that clicks along the spine, and it actually feeds information into a computer to let us know which of those segments of the spine is stuck. And then it clicks again at that same joint for us to deliver the adjustment and restore motion. So many of our patients prefer that type of adjustment, especially our elderly patients that may be more fearful of having a forced delivery to the system. So we're always happy if somebody is just truly not wanting to try a manual adjustment or to lay on the table. Absolutely, we can work with you with any of our other technology that we use as well to make the patient most comfortable, but still help to balance the system efficiently.
That's interesting.
I'm sorry. I've been to your clinic and it's amazing. I mean, you guys are by far, and I've been to many different chiropractic clinics, and it's by far the biggest and has the most equipment and has the most additional services, like you said, massage, but you have physical therapy and all kinds of other things available for the patients, so that they can work with their. For me, a really big priority is if I have an adjustment that I could go to get massage right there, get the other therapies that I need right there, not have to go somewhere else for that. And I mean, it's so big. So it's neat that you're saying this about. I didn't even know you had these other techniques available or the other equipment available.
Yeah, absolutely.
Yeah. And just to touch bases on that, that's a great point, Greg. Dr. Hurley I've been going to chiropractor obviously for a long time, and your technology that you have already, my chiropractor does not have that, but it seems like with modern technology, you can deliver an experience to your patients that are just far beyond just even the manual adjustments. I'm sure are fine, because I enjoy going and getting my manual adjustment that she gives me, but it just sounds like you can deliver a lot better experience. So, but what is, from your perspective, I've seen some of the reviews on your website at Hurley Chiropractic. I've seen it, and I love the way it just seems like you're really family oriented, but maybe you could talk a little bit about your family and how you deliver this experience, because it seems like everybody really, I mean, you have patients that you were telling me that you have a patient that's been there forever. She was used to see your mom, and maybe share some of that experience, because to me, it's kind of like, something to be said about somebody that has been going for this long in your company and far, even way before you were around, but maybe share that a little bit.
Sure, absolutely. So, as I mentioned, my mom was a chiropractor, and I received my first adjustment the very day that I was born by her. And so we truly did grow up with chiropractic being every part of our lives. And I was also inspired to become a chiropractor from working in my mom's office. Truly, from a young age, my grandma was her office manager, and two of them ran the office by themselves for a long time. And I remember coming in being maybe 7 or 8 years old, and my grandma putting me to work filing travel cards, and as I grew up, I was able to be a part of every aspect in the office, and being able to talk with patients and hear them say how their lives have changed. I can play with my grandkids now. I don't suffer from migraines anymore. I don't miss days of work or school anymore because of chiropractic care. Truly inspired me to become a chiropractor. I have 2 younger siblings. My brother is Nick Hurley. He does own a Taekwondo studio in the area, but he's also been instrumental in helping me to learn to take over the business, as he's experienced in running a business, and helped my mom with that while I was at chiropractic school. So together, the 2 of us as a team has really learned how to kind of take over this clinic, and not only be able to deliver really wonderful care to our patients, but make it an efficient business as well. So, and then our youngest sister, Rachel, she is attending UCA, and she's currently on the pre-med track. And she also comes in and helps and works in just about every department and wherever we need her when we need her. So not only is it a family company, a family business from our side of things, but we also prioritize so much taking care of families. Like I said, from grandma and grandpa to the newborn baby, we can really help everyone to get the best care that they need.
That's very good. Very good. Well, we'd like to have you on a second time, because, we have to have you on another in a few more weeks, because this is really good. And I hope people, everybody in Conway, but it's not just Conway. We only have a few more minutes, Dr. Hurley, but could you explain to us, where are the areas that you really pull most of your clientele from? I know where you are in Conway, but are there some surrounding cities that you pull some people from?
Sure, yeah. People travel to see us from the surrounding towns, especially Maumelle, Little Rock, Bologna, Greenbrier. People travel to come see us. And if you're ever looking for a great chiropractor, but think that the travel would be too much for you, you can always contact our office and ask if we have any recommendations in your area. Sometimes we do, sometimes we don't necessarily know somebody personally in the area, but would be happy to give you some ideas of what to look for, how to shop around for a chiropractor, and what to expect so that you can have the best experience.
That's great. That's great. I think some of our people that might watch this might be from way far away, and they'd really appreciate that.
Sure.
Yeah, definitely. Definitely. Well, if somebody wants to reach out to your office, what would be the best way to contact you or your team and your doctors? Would it be the hurleychiropractic.com, or what would you recommend?
Best way is probably to call our office. We have great front desk staff that's there anytime, and they can always relay messages to myself, and I'm happy to take a message, get an email, and be able to correspond with people that way. We also have our Facebook page, Hurley Chiropractic, and you can message me on there, and I'll usually get back pretty quickly if you have a question about chiropractic, or if chiropractic can help with a specific issue you're having, and I'd be happy to answer questions that you have too.
Oh, perfect. Perfect. Okay. Well, we appreciate you, Dr. Hurley. Greg, I think we've had a good interview here with Dr. Hurley, and I really feel like in the community alone, I can recommend this from somebody that's been on the other side of it. And I can only recommend this, that maintenance is so important. You do it with your cars, you do it with your homes, your air conditioners, and then we forget about our bodies, and then we land up having to go to a doctor. In my opinion, so many of my friends, I'm 54, but so many of my friends, they say, well, I have to go to the doctor. I was like, have you tried something different first? Try getting adjusted, because I know I've had problems with my hands over the years with carpal tunnel, maybe from doing some, punching, boxing a little bit and whatnot. And I think that, in the long run, I always get fixed. and I've never had to have surgery yet. So if I don't have to have surgery, the longer I can go, I know one day I might have to, but it's really, I do appreciate what you do. And I appreciate the service you deliver to people, because I know that the stress reduction is just a great deal when you can alleviate pain. And sometimes the stress levels alone, just from something simple as a knee ache, I can't ride my bike today, and I was like, oh, I want to ride my bike. I do 25 miles 3 times a week and I can't ride my bike. You go see the chiropractor and they just take care of you right away. So I'm going to recommend anybody out there right now watching this, stop by Dr. Hurley's office, get to know her staff and her team. And it's a great group of people, and see what she can do for you. That's something that's going to be for longevity, something that's going to last you, in your life and take care of you. And Dr. Hurley, we do appreciate it. Thank you.
Thank you, man.
For having me.
Thank you.